Hey everybody, it's Dr. Sadler again here with your question of the week. Okay, so this week's question says, the nursing instructor asks a nursing student to identify the priorities of care for an assigned client. Which statement indicates that the student correctly identifies the priority client needs? All right, so let's look at our options. Number 1, actual or life-threatening concerns. Number 2, completing care in a reasonable time frame. Number 3, time constraints related to client's needs. Or number 4, obtaining needed supplies to care for the client. Okay, so you may want to go look at my previous video that I recorded on determining priority client needs. It identifies several things you're going to look at when you're looking at, when the question asks you, what's the priority? What do you do first? What do you do next? That means what is of immediate concern. And there are certain things you want to look at when you're looking at immediate concerns. What do you do first, right? All the things are important and you're going to do them at some point, right? But what do you want to do first? You're going to look at some things that could potentially be life-altering or life-threatening or whatnot for that patient. And so when we look at these options that we have here, let's look at actual or life-threatening concerns. Obviously, a life-threatening concern is something we want to address, because life-threatening means they could potentially die if we don't address this concern immediately. Number 2, completing care in a reasonable time frame. Yeah, we want to complete it in a reasonable time frame. However, is that going to kill our patient if we don't? Time constraints related to client needs. We do have certain time constraints. Maybe they got to go to PT, or maybe they got to, we do have some time constraints that we need to, think about. However, if we don't adhere to those time constraints, is that going to kill the patient, or is that going to seriously injure the patient? Obtaining needed supplies to care for the client. Obviously, you want to do that, but again, is that going to kill the patient, or is that going to cause serious injury or harm to the patient if we don't get all the supplies we need at one time? So when we look at these options, actual or life-threatening concerns, that's going to be our priority, because that could potentially seriously harm our patient or even kill our patient if we don't tend to those needs first. Again, you want to make sure you go back and look at that video, because there's several things that I outlined for you on how to determine a client's priority needs. Okay, so we said our answer was actual or life-threatening concerns. Let's read our rationale. Setting priorities means deciding which client needs or problems require immediate action and which can be delayed until a later time because they are not urgent. Client problems that involve actual or life-threatening concerns are always considered first. Although completing care in a reasonable time frame, time constraints, and obtaining needed supplies are components of time management, these are not the priority in planning care for the client based on the options provided. So if you enjoyed this video and would like to see more like them, then please consider subscribing to my YouTube channel. Have a great day.